Hi, I'm Christina. I'm going to be your student nurse today. I'm going to give you a physical from head to toe, and then if I could start by getting your name, date of birth, and age.
Yeah, my name's Kevin Shirley. I was born 10/13/1997, and I'm 22 years old.
Okay, good. So I'm going to start just by doing a general skin inspection, and just at first look, you have even coloring, no lesions or scars present or seen. And then I'm going to just start with doing your head to toe and work my way down for your exam. So I see even hair distribution, and then your facial features, if you could just keep your head straight, is symmetrical. And you have even hair distribution on your eyelashes, eyebrows. They're symmetrical and in line with each other. And your eyelids come at the top of your iris, which is normal and good. And if you could shut your eyes real quick. Okay, and open. And then your eyelids touch your lower lid when you close them, which is good. And then I'm just going to look at your sclera and cornea, which are clear and glossy, which is good. And then if you want to look up, I'm going to depress your lids and look at your conjunctiva. Okay, which is pink and moist, also good. And then I'm going to do a more thorough exam of your eyes by testing some cranial nerves. So we're going to start by testing cranial nerves 2 and 3. And first we're going to do reaction to light. So you can just look straight at me, and then I'm just going to look at your pupils' reactions. So first I'm going to do direct. So that reacted good. And then consensual on the other side. Okay, that was good. I'm going to do it one more time on the other. Direct was good and consensual. Okay, so those were even and reactive to light. And then I'm going to do accommodation. So just testing if your pupils constrict and dilate with distance and nearsightedness. So if you want to look behind me at the rail on the back wall. Okay, and then look at my pen light here. Okay, good. So they constricted and dilated right. And then I'm going to test cranial nerve 2 by doing visual fields of confrontation. So I'm going to have you cover your left eye. Okay, and I'm going to cover my right. And then when you see my hands like wiggle in your peripheral, just say, see them. Okay.
See them. See them.
Okay. Same thing.
See
Look
them.
at me.
See them.
Okay. And then cover your right eye. Cover my left. And the same thing.
See them. See them. See them. See them.
Okay, good. And then I'm going to test cranial nerves 3, 4, and 6, which are your extraocular movements, to test for smoothness, and so I don't see any staginess when you're trying to move your eyes, and your muscles are all good. So you're going to follow my pen light. So I'm going to start at the center, and then keep your head straight, and then just move your eyes. Okay. Good, and then convergence, follow it in. Okay, good. Your pupils are equal, reactive to light, round, and they accommodate good, and then they converge nice, and they have good, smooth, even extraocular movements. Okay, now we're going to do your posterior thorax inspection, palpation, and auscultation. So upon inspection, same thing, skin integrity intact, good coloring, no lesions, scarring, and then if you could take a deep breath for me. No use of accessory muscles, your chest shape is even and symmetrical with breathing, and you don't have any retractions or deformities. Okay, and then I'm just going to palpate and tell me if you have any tender areas. Do you have any? Okay, and then I'm going to check chest expansion, so go to about T10. And then if you want to sit up, just quick, and take a deep breath. Okay, good. Even chest expansion on both sides. And then I'm going to check for tactile fremitus. So I'm going to put my hands on you like this and say 99 each time that they touch you. Okay?
99. 99. 99. 99.
Okay, good. Even vibrations on both sides felt. And now I'm going to auscultate your breath sounds. And there's going to be 14 sites, so if you want to take a deep breath in and out through your mouth whenever my stethoscope touches your skin. Okay, and they were clear to auscultate bilaterally, and it sounds like good normal breath sounds. Okay, now we're going to do your anterior chest inspection and auscultation. And then again, I see intact skin integrity, good chest expansion, no use of accessory muscles, and your AP ratio looks 1 to 2, which is normal. And then your symmetry also is in line. So now we can start auscultation of your breath sounds. Same thing, in and out of your mouth as you breathe, and feel my stethoscope on you each time. And there's 12 sounds this time.
Okay.
Okay. Ready?
Yep.
Okay, and those were good. Clear to auscultate bilaterally, and normal breath sounds. Alright, now we're going to do your cardiac assessment. I'm going to start with your carotid arteries. Just upon inspection, I see slight pulsations, but no jugular vein distension, and nothing to worry about there. And then I'm going to palpate. That's +2 normal. Also +2 normal. And then I'm going to auscultate your heart sounds, so breathe easy in and out through your nose. And then if I listen longer at any point, it's just to make sure I'm getting a good listen. There's nothing to be concerned about. Before I do that, I'm going to palpate your PMI. So if you want to lean forward a little bit, you go to your 5th intercostal space, and then mid-clavicular line. And then if you want to lean forward. Okay, good. And that was strong. +2. And then now we'll auscultate. Alright, so I'm going to start at the 2nd intercostal space, right sternal border in the aortic area. The 2nd intercostal space, left sternal border. Third space, Erb's point. Fourth, the tricuspid area. And then the 5th intercostal space, mid-clavicular line, your mitral. Okay, good. And then I'm going to go back up with the bell of my stethoscope to listen for any irregularities or murmurs. So we'll go back to the mitral spot. Okay, and the tricuspid. Erb's point. Pulmonic. And aortic. Okay, and your heart sounds are clear, normal, and they all sound good. Okay, and for the abdominal inspection and auscultation, just when looking, I see skin integrity intact, even coloring, no obvious protuberances or masses, and I'm going to auscultate each quadrant, so you can just breathe normally. Okay, and I heard normal sounds at a normal rate, and then I'm just going to check your temperature, which is warm and even bilaterally, and your skin texture is smooth, no roughness. Now we're going to do peripheral vascular inspection and palpitation, and for inspection I see your skin integrity is intact, your coloring is even and uniform all throughout your lower extremities. And I'm going to check for your temperature, make sure it's even. Okay, and that was warm and even bilaterally. And now I'm going to just make sure your texture is even. Good, texture is smooth, and your skin moisture is about normal to dry, and you have even hair distribution, which is all good. I'm going to check for pitting edema, which I don't see anything. Right, and there isn't any. And then do you have any tenderness?
No.
No? Okay. I'm going to test your pulses. So I'm going to start with your dorsalis pedis. Okay, and that was +2 normal. And then your posterior tibial. Okay, and that was also +2 and normal. Alright, and for your upper extremities, for peripheral vascular, again I see your skin integrity is intact. If you can put your arms out a bit. Okay, and even coloring, and then I'm going to check for mobility and turgor, so I'm going to pinch some skin right here, and then release. And it went back to normal quickly, so your skin's hydrated, and it's normal to dry. And then now I'm going to check for temperature. Your hands, if you want to extend them like this. Okay, and that was warm and even on both sides. And then I'm going to do capillary refill, so if you want to put your hands like this. Okay, and that was good. They blanched and then went back to normal in under 2 seconds, which is good circulation. And now I'm going to check your pulses. Turn over. I'm going to do your brachial pulses first. Okay, and those are +2 and normal bilaterally, and your radial. And those are also +2 and normal bilaterally.